To tell you a little bit about it, but I think my good friend Adrian did such a beautiful job, so I can build on some of the things. There you are with my purse. Build on some of the things she said. I met Adrian a few times, but the one I was remembering, we were sitting in a clinic in the mountains of Lesotho, and that clinic previously wasn't working at all. And I think that's where I want to sort of start my story, not necessarily in Nohana, but what health was. So I had the interest in working abroad. My father was from Calcutta. As a kid, I went to Calcutta during some very difficult times in the 70s and saw a lot of people who were very sick and hungry. And as a kid, I could not make sense of it. I grew up very privileged. My parents were both college professors. I grew up with a swimming pool and a boat. And being in Calcutta in the 1970s, I saw the millions of people who had fled Bangladesh, who had come to Calcutta, who were hungry. Some even had diseases like leprosy, which I learned about as an 8-year-old. And it just seemed so deeply unfair to then return to my country and my privilege and to look around me and understand that none of my neighbors, my playmates, their parents knew anything about this. And I felt really broken, even as a kid, by this deep injustice. And so I, as a very weird and nerdy kid, became like kind of a seeker. Like, how could the world become like this schism between people who are sick and poor and people who are not? So, throughout my life, I was sort of searching, and then I went to college, like maybe a couple of you, in the very beginning of the AIDS pandemic. 1981 was the first cases of HIV that were recognized. We didn't even have a name for it at the time, and that was the year I started college. It was also a very conservative era in the United States. It was the Reagan era. So it was this confluence between a terrible disease, immediate stigma, and a politic that just didn't want to see the people who were suffering. So it seemed like kind of a calling, right? And I met a lot of amazing activists at the time, and I really got sort of steeped in the injustice of HIV, even before there was treatment or anything. But it was within 2 years that we saw the even deeper schism that would come from race. The very first paper on HIV in the United States that had to do with Black women was called Children Born to Promiscuous and Drug-Addicted Black Mothers. This is a kind of outrage that you just said that I felt, right? We had terrible stigma in my beloved second home of Haiti, which really was tarred with the idea of HIV, and that's a whole other story that I will go into. And then the disease hit the African continent. And so I was in medical school at the time, and the first time I set foot in Africa, I was in Kenya in 1991, and HIV was just moving along. It was just coming through. Nobody really understood it. Even I didn't know how serious it would become. So I went with a public health program, and as a young physician, I was already trained as a physician, I was told there's nothing you can do for people except prevent disease and teach them to do smarter things. Like, people are sick because they don't make good choices. So I was in a child survival program. That's what I was supposed to do. And you've probably seen pictures of these. People think it's like sweet, but it's not sweet, right? You weigh babies. They usually put the babies in a bucket, weigh them, and then you graph them on a little growth chart. I did that. And what we saw was, lots of kids. And some kids would be on the growth chart, and then they'd be falling off the growth chart, losing weight, losing more weight, losing even more weight. What would you do if you saw a kid that was skinny, that was starving? What do you think would do? What would a normal person do? Feed them. We're taught, no, the problem isn't food. The problem is the moms don't know what to feed their kids. So I was taught, I'm not that old, I mean I'm pretty here now, but I'm not that old. I was taught that we would take out a poster with the 4 food groups and say, Mom, your kid is skinny, they need more protein. And I point to the chicken leg. I said, that could be a chicken leg, could be an egg, maybe it's beans. And the mom would just look at me with just a blank stare and just shake her head. Is it horrible? It's like makes you want to weep, right? I did this because that's what experts told me to do. And I was broken by that. I was just absolutely broken. And I came back to the United States where, my first rotation after seeing 70, 80 kids die of malnutrition with this stupid poster thing. My first rotation was on the pediatric transplant unit. And I want those kids to get transplants. But it just seemed this crazy schism of the world. And then HIV happened. So even the little gains we made from those stupid programs, prevention only, just all we could do is called GOBI. Growth monitoring, like you monitor, but you don't do anything. Promote breastfeeding, immunize. That's it, GOBI. Just do that. Anything else is considered not sustainable. These countries are too poor. People are just making bad choices. They're not smart. And then HIV clawed back even the little gains we made from immunization. So I went back to Africa, still thinking that the idea was to prevent stuff. Even though I was a doctor. Right? Even though I treated kids with pneumonia, with diarrhea, I'm a pediatrician, I'm an internist, I treated kids with meningitis, treated adults with diabetes, and I would go back and people say, just teach people, teach men to fish, right? So the second time, I lived 2 years in Yukon and really high in the HIV epidemic, and we were teaching kids, teenagers, to avoid HIV, how it's transmitted, how it can be prevented, etc. And I was a little smarter this time, but I was there a little longer. So we get together with all these kids, and then we say, okay, now tell us, what are your 5 top risk factors? You understand how HIV is transmitted. In this community I was working with, 35% of the adults have HIV. 35%. So we're trying to protect the youth. They were the window of hope. That's what they told us. So we said, okay, what are your main risk factors for HIV? And all the kids, 2 years, 92 public schools, Catholic schools, religious schools, 92 schools, all the kids said the same risk factor. What do you think, Russ? They would have said rape, that's what I would have thought, but it wasn't rape. Poverty. All of these kids said poverty. That was their number 1 risk factor. And because I had really been broken by that whole Gobi thing, I actually got a little smarter. And I said, tell me more. Explain that to me. I don't understand with my swimming pool in a boat, right? And the girls particularly said, look, Auntie, school is not free. I'm already an orphan. And if some man in my community will help me pay my school fees and they want to have a relationship with me, I have to do that. Because the risk of me not learning to read and write is much worse. That's today, right? It's much worse than some condition, which I do understand, but that's maybe 10 years down the road. And many times these kids were adults, they were heads of households, taking care of siblings, right? So I came back from that experience thinking, I don't know anything, right? Medical school, bachelor's degree, medical degree, training at Harvard, and I am absolutely ignorant of the lives of poor people. And that's when I started really trying to study human rights and practice what we call social medicine, which is to understand that zip code, postal code, is much more related to whether you live or die than your genes, than a microbe, than your behaviors. It's about zip code. Right? I thought, why do they teach us this in medical school? It's all this biomedicine, but no biosocial analysis. And the year I came back from Uganda, after having gone to 250 funerals, I kept track, was the year we found the cocktail in the United States, the drugs that turned HIV from a death sentence to a chronic disease. Many of my friends with HIV have been living many, many, many years. They're doctors, they're lawyers, they're fathers, they're mothers, they've had fulfilling lives and continue to have fulfilling lives. And I thought, of course, 1995, we're going to take those medicines and we're going to put them where 95% of the epidemic is, which was in sub-Saharan Africa. Nope, not 95, 96, 97, 98, 99, 2000, 2001, 2002. 8 years. Each of those 8 years, 8,000 people died a day of HIV on African continent. And of course, their kids were dying of malnutrition and pneumonia and as orphans, right? This cataclysm, this pandemic cataclysm is going on under our watch, and we had the medicine. Right? And it was always, it's too expensive, it's not sustainable, people can't take their medicines. They told us, oh, Africans can't tell time. The head of the U.S. Agency of International Development said, Africans don't have watches. And they tell time by the sun. Now, I know lots of Africans who are college professors, who are doctors, who are super smart farmers, and nurses, and pharmacists, and teachers. And they tell pretty great time, right? These were all excuses to continue to justify this totally disparate world of people who had the fruits of modernity and people who did not. And so I found the one organization that was treating a handful of people for HIV in Haiti. And the name of that organization is the name of my good friend Alain and Livy and others work in Sami La Santé. So I met our colleagues, and I said, I'll work for you for free, because I am an infectious disease doctor. I just want to put pills in people's mouths. And that's when I learned from my friends, my patients, my colleagues in Haiti, that they already understood all these things that it took me many years to learn. That poverty constrains your choices, makes you sick, and yet they all, to a person, whether it was a mom with 3 kids who was a peasant farmer, whether it was a nurse who was working in a health center, they all had the same aspirations that I had. To be healthy, to have leisure and joy with their families, to have healthy children, to send their kids to school. And I got hooked because Partners in Health was the only organization that was willing to treat HIV and to keep treating it, to treat tuberculosis and to keep treating it, to treat cancer and to keep treating it. We don't say, oh, you have cancer, but you're Rwandan, so you don't get treatment. My kid had cancer when they were 2.5. They're 18 now. No one said you are not cost effective, Artemis Mukherjee Smith, right? They're going to go to college. And so Partners in Health is an organization that has bucked that trend to say some people get nothing and we justify it by saying they're making bad choices, it's behavior, their countries can't afford it. And we say, we all have the same goals, the same aspirations. The lives of our families are the same in worth to the lives of the families of our friends and our patients around the world. And so Partners in Health, along with AIDS activists around the world, along with health activists, really started to change things. And today, we helped create billions of dollars of new money for HIV, TB, malaria. Today there are 32.7 million people in the world on HIV treatment, and they get it for free. Because we showed it could be done in Haiti, and then we use that evidence to fight for change. That's one step, right? That's one disease. We still have cancer, we have diabetes, we have mental illness, and we're still fighting that fight with our brave, amazing colleagues in Haiti, and now in Rwanda, Lesotho, Malawi, Peru, Mexico, Kazakhstan, Russia, the Navajo Nation, and always saying that everybody deserves the basic right to health. There are not two sets of rights. There are not two sets of needs. There are not two sets of humans. There are not two sets of aspirations. So when people say they are a PIHer, that's what we call ourselves, that's what we call any of you who want to join the movement, we say we don't tolerate a second best. We want everybody to have the right to health care. It is the 21st century. We have the tools, we have the money, and we cannot continue to make separate worlds. And so for all of you, I invite you to come to any of our sites. Haiti's a little complicated right now, as our Haitian colleagues will tell you. See the work we do, see it online, see it in person, and really see the people we care about. That's what I was just saying to Adrian. Like, the only difference is if we can't see people. Right? If we can't see people as human as we are, as we can't see children as innocent and beautiful and wonderful as our own children, that's what we lose sleep over. How do we get people to see that? And so I just want to thank you for spending the time with us. I only have a few minutes. I was going to wait for one picture. Can you flip through quickly, or is it just on the same loop? On the same loop? I know most of these people. It's like the great privilege of my life that these are my friends. These are my kids' aunts and uncles. I know everybody's name, but there's one girl here, and I'll just keep talking till we get to her, and I'll end on her. Her name is Adeline. She's from Sierra Leone. She's a twin. When I first met her, she was laying in a bed. She's about 14, and her twin, she was in coma. And her twin was sitting by her bed. And her twin said, "Doctor, please, can't you save her life? She's my best friend." That's her. She had tuberculosis in her brain. And all she needed was 4 medicines for 9 months. That's it. She didn't even need any injections. She didn't need anything. But the thing is, she needed a CT scan. There's only one CT scanner in the country, and it costs a lot of money. So we sent her to Freetown. We got that CT scan. We said, yes, indeed, this is tuberculosis. And the next time I came, actually, my colleague brought Adeline to see me with her mom and her twin sister. And so that's just one person. That's one person of the hundreds of thousands of people that deserves a shot, right? She's in school. She's going to graduate from high school. And her twin still has her best friend, right? So how can we not see people like Adeline? How can we not, how can we deprive that family of that beautiful young girl? So thank you all so much.